It is hard now to get in to see a doctor. And even if you have a GP, you have had for years, now you may have noticed it's costing a little bit more. 9 out of 10 family doctor clinics plan to increase their fees if they have not already done so. A new study out today by the General Practice Owners Association, which carried out the survey, said primary care was in crisis, squeezed by rising costs, high patient demand and staff shortages. Joining me now is Chair of General Practice New Zealand, Dr. Bryan. Bryan, good afternoon. Great to have you on the show again.
Oh, good afternoon, Leah. Nice to be here.
Now, I think we've had this conversation before, but now we've got the survey commissioned by GenPro, shows GPs' workloads have increased, patients' attendance is up, and then funding by the government, their 4% is the largest shortfall in 20 years. GPs have no choice, Bryan, but to put up their fees, correct?
Yeah, look, this is a really unfortunate situation in that the funding model and the funding for general practice has not kept up with costs. And one of the things that your listeners may not be aware of is the government doesn't fully fund general practice. So there is a co-pay that the patient has to pay to make up the income. But what we've seen over the last 10 years is the increases haven't kept pace with inflation. This year's one is way less than we think it should be, which is about 9%. And therefore, the only thing that can be done is an increase in fees. And, GPs are reluctant to do this because it is a cost burden on the patient, but there is no choice but to do it. And a lot of practices and a lot of surgeries or clinics around New Zealand are actually now running either at cost neutral or actually running at a loss. Jeez. And that's really, really worrying at this point.
And it's not just the funding, which you've explained, Bryan, is dire. Nearly 60% of practices, according to this study, reported vacancies for doctors and nurses. Where have they all gone?
Well, look, what's been happening over the last few years, again, is we haven't been training enough general practitioners in New Zealand. This has been happening for 1 to 2 decades, and it's suddenly reached a crisis. Now, the reason it's reached a crisis is we're very dependent on overseas trained doctors. About 40% of our workforce is overseas trained. But over COVID, the borders shut. Doctors stopped coming into the country. And now what we've seen internationally is a shortage of general practitioners across the globe. So we're competing against other countries. So, we estimate we're about 400 to 500 GPs short in New Zealand. And that's really, really coming to this point of falling off a cliff. Now, the other thing that is a problem is we estimate about 50% of GPs are going to retire in the next decade. So we've got this accumulation of problems that have come together at once with funding, with a workforce shortage and a looming crisis with the number of GPs who are about to retire or back away from practice. Gosh. So, it is a real issue at this point.
And what is disturbing is that, excuse me, I mean, isn't what we're seeing at the moment going to cost the system more in the medium and long term if patients can't get primary care?
Oh, look, 100%. What we do know is that if you can't get in to see your general practice, your primary care provider, your doctor or your nurse, that problems can get worse. So, or you need to see someone, you end up at the emergency department, or if the problem has got worse, you may end up in hospital. So where we see a decrease in the number of GPs in a particular area, or access to general practice in a particular area, we see a very large increase in presentations to emergency departments and admissions into hospital, and that's very, very expensive. So it costs the system a lot of money, and it's actually bad for patients. It's bad for the population, and it's really, really not a good place to be.
Well, I mean, I saw today in a completely different story, but it just highlights what you and I are talking about patients in like one of the most impoverished communities, so desperate. This is in Atara Clinic, South Auckland, and lining up outside clinics at 6 a.m. just to hope to be seen. I mean, this is not first world country stuff, Doctor, is it?
Look, it's something we shouldn't be seeing happen. And look, I did read that story and I had a look at it, and it is distressing. It's distressing for the patients. It's distressing for the clinic, which doesn't have enough staff to service them. And as we've just talked about, it's really bad for the long-term health of New Zealanders and to the health of the system. So, yeah, this is a real problem. I work in Cannons Creek in East Pararua, which is very similar to Atara. And our clinic has now had its books closed for the last 6 to 8 months because we just don't have enough staff. And so we've got a waiting list of people who want or need to see a general practitioner or a doctor. And at the moment, our books are closed, and it's purely due to the fact there's not enough staff. And when that happens, you've got to be very careful you don't get into an unsafe situation. So yeah, we're seeing this right across the country at the moment, and it is something that I think is the government really does need to step up and think very hard about the funding and what it's going to do here.
Yeah, I mean, I'm glad you brought that up because, Health Minister Dr. Shane Reti has said he has acknowledged long-standing pressures of primary care, and he wants to include, his actions are 25 new training places for GPs this year, a business case for a third medical school, and the largest GP training cohort ever, he reckons, of GP registrars completing training. And this is kind of okay, but isn't this not long term? How do we get around it now? Or what can we do to improve now?
So certainly increasing numbers and increasing the number of GPs we are producing in New Zealand is a really important long-term strategy. And look, I'll give credit to the government that they are thinking about this and they're putting in place long-term plans to increase the workforce coming through. However, in the immediately, what we do need to be doing is making sure it's easy for general practitioners who want to come here from overseas, that they can get into the country easily through immigration, and we can employ them. That we're building what we call multidisciplinary teams, so we're having our nurses work top of scope, and we've had adequate nursing staff, things like paramedics, health improvement practitioners, a whole range of people coming into general practice to work. But also, that general practice is sustainable in this country, and this comes back to the funding, which has become a real issue, that we need to be able to employ these staff, the different staff members that are required, the different GPs that need to come in and work for us, and that general practice is sustainable long term. So I think there are some urgent financial issues that need to be worked on, because if we don't, the health system is going to be put under more and more pressure as we go on.